Hi, this is Justin Vaughn with MiraMed Global Services. Our article today is entitled Safety First, Rules and Tools for Keeping Patients Safe. Let's begin. This is a true story involving a close family member. A mom and dad were with their young son just prior to the boy undergoing a procedure at a medical facility. The nurse came in to administer some type of sedation. A few minutes later, a different nurse entered the room, announcing that she needed to administer sedation to the child. That prompted the dad to speak up and point out that another nurse had already administered a sedation drug within the last few minutes. Upon hearing this, the second nurse checked the chart and confirmed with the other nurse that indeed this was the case. So in this instance, it was the intervention of a family member that prevented potential harm to a patient. Circumstances like the above are quite sobering and should never happen, and yet they occur far too often. What if there is no friend or family member to intervene? Hospital patients should be able to rely on the expertise of their nurses and clinical staff as they undergo treatment and recuperation, rather than having to worry if they are putting themselves in harm's way. A 2016 report appearing in Johns Hopkins Medicine found that over 250,000 deaths occur in the United States due to medical error in the hospital setting. When comparing that figure with total U.S. deaths, hospital-based medical errors were found to account for 9.5% of all deaths in this country, ranking third behind heart disease and cancer. It should be noted that at least one study, specifically from Yale University researchers, has disputed these numbers, suggesting the figure is closer to 1% of U.S. deaths being due to medical error. Nevertheless, all agree that the number of preventable deaths in the hospital setting is too high. This section is entitled Investigating Causes. The lead author of Johns Hopkins study, Dr. Martin Macri, indicated that the blame for the high error rates should be placed more on inadequate regulatory systems and facility processes rather than on the individual clinician. Yes, there will always be human error, but such error can be minimized through more effective strategies. For example, many medical mistakes occur through administering incorrect medications or dosages. This often goes back to the hospital pharmacy, where a good portion of the medication preparation is handled by pharmacy techs. One study pointed out that there are insufficient regulations in some states covering the training, practice scope, and supervision requirements relative to pharmacy techs. In the words of the Johns Hopkins study, quote, most errors represent systemic problems, including poorly coordinated care, fragmented insurance networks, the absence or underuse of safety nets, and other protocols, in addition to unwarranted variation in physician practice pattern that lack accountability, end quote. So, what can be done to support patient safety and reduce medical errors? This section is entitled Identifying Solutions. Dr. Macri of the Johns Hopkins study suggested that there are things that governmental and healthcare entities can do to improve the safety of patients in the hospital setting. Among these is spending more money on research. We spend hundreds of millions on cancer research and heart disease research. Now it's time to spend larger amounts on this third leading cause of deaths in America, at least in Macri's view. On this topic, he stated, quote, unwarranted variation is endemic in healthcare. Developing consensus protocols that streamline the delivery of medicine and reduce variability can improve quality and lower costs in healthcare. More research on preventing medical errors from occurring is needed to address the problem, end quote. The topic of patient safety is of major concern to the Joint Commission, or JC, as well. The JC has recently released its own Hospital National Patient Safety Goals, or NPSGs, for 2021. These are objectives that hospitals should try to meet in the coming year, and they include the following. Number one, identify patients correctly. Too many times medical errors occur due to wrongly identifying a patient. This NPSG requires using at least two methods to identify the patient, such as their full name and date of birth. 2, improve staff communication. For example, hospitals should find a way to get the right test results to the right individual in a timely manner. 3, use medicines safely. This goal stresses that prior to procedure, medicines should be properly labeled, including medicines in syringes, cups, and basins. This should be done in the area where medicines and supplies are set up. In addition, extra care should be taken with patients who take medicines to thin their blood. Staff should make every effort to determine what medicines the patient is taking. They should then compare those medicines to new medicines given to the patient. This NPSG also requires that patients be given written information about the medicines they need to take. 4, use alarms safely. Hospitals should make improvements to ensure that alarms on medical equipment are heard and responded to in a timely fashion. 5, prevent infection. Hospital staff is encouraged to follow the hand cleaning guidelines of the Centers for Disease Control and Prevention, or CDC, or the World Health Organization, also known as WHO. Goals should be set for improving hand cleaning. And then 6, prevent mistakes in surgery. Make sure that the correct surgery is done on the correct patient and at the correct place on the patient's body. Appropriate staff should mark the correct place on the patient's body where the surgery is to be performed. Clinicians are urged to, quote, pause before the surgery to make sure that a mistake is not being made, end quote. The full text of the JC's NPSGs, these National Safety Goals, can be found on the Joint Commission's website, jointcommission.org. While these goals are important, some may find them a bit generic. They are good reminders of common sense protocols, but may not explore how new technologies can be leveraged to make significant reductions in medical error, at least in the estimation of some. Are there other strategies that may help to augment the JC goals? This final section is entitled Technology and Tenacity. A 2018 CNBC report discussed using technology to advance patient safety. They pointed to companies that specialize in patient safety, including one that has developed and implemented a computerized physician order-entry program at LDS Hospital in Salt Lake City. Quote, harnessing health information technology through the use of electronic health records of hospitalized and ambulatory patients is essential, end quote, according to one of the company's officers. While it's clear that electronic medical records, or EMR, systems can be increasingly used to mitigate mistakes in the clinical setting, the key is to ensure that fail-safe protocols are programmed within these systems that will alert staff before a clinical error is committed. Accordingly, programming should be continually reviewed and tweaked to make sure the EMR is increasingly efficient and on the road to becoming error-free. The bottom line is that hospital executives must be tenacious in their efforts to root out medical mistakes. But no effort to reduce error can be fully effective without strong data. Hospitals must have systems in place to consistently and accurately identify the cause of errors leading to adverse events. The IT department must have the proper tools in place to capture and catalog these errors. Analytics must be in place to allow decision makers to easily determine where the risk areas are. Once these are determined, the hospital must act decisively to remove or reduce these risks to the extent possible. No hospital is happy with the human error or equipment failure that leads to a tragic outcome for a patient. The good news is that there are ways to reduce these untoward events as discussed above. If we can help you in this process, please contact us at info@miramedgs.com. Thank you.